Welcome to Studying for FRCS. This is Sai from the Mindful Learner. And today I have a bit of different presentation. That is, this video is about how would I have prepared for FRCS if I was an ST3. And it's sort of like a reflective video of things I might have done differently. To those of you who are new at the channel, Studying for FRCS is actually a podcast that I started while I was studying for mine. And it is about building a community for all of us who are studying for the exam, basically. So if you want to know about Studying for FRCS podcast, please feel free to do so. It's available in all the major platforms. So let's move on. So after the exam, I got asked by a lot of people about how I prepared and how would they prepare and what advice would I have and everything, which is why my previous video is that how do you prepare for part 1? Because I do feel like there is although everyone does it, but there is a lack of explanation of what is the best way or what are the ways to do it. So I've given my take on that. But among all of those people, I had a lot of ST3s who were asking me about this. Well, not a lot, couple of ST3s. And my first reaction was a bit surprised because, as an ST3, to those of you who are not familiar with the UK system, ST3 is our first year registrar and our total training is 6 years. So we have at least 4 years before we go to our ST6 year, when upon finishing it, we have to have an outcome 1, and so that we can sit for our exam in ST7, which is a huge matter because on those 2 penultimate years, you have so much other competencies to do that it's really quite a stressful time. So ST3 year, is the loveliest time. You've just become a registrar, you are the baby registrar. Everyone gives you that sense you're protected, you are cared for, your ARCPs are not that difficult usually also. So this is the most loveliest time. So I was thinking, like, why are people asking me about the FRCS? And that's because the FRCS is an exit exam. So when you do your FRCS, you're actually ready to be a consultant. That's how FRCS system is designed. So for an ST3 who's just starting their training to an ST7 or someone who's at the end of their training, so it was an interesting, question. But then when I looked back at it, I had a reflection regarding how my training went and what I could have done differently, or also on the things that I did do differently, which actually helped me. Because people think that, when you are in a training pathway, life is actually rosy, but it is not. Our training pathway is sort of like this. So it's like an uphill, it's a mountain, it's a steep climb, basically. And if you are in a training pathway, you are under a time pressure to get qualifications, to get competencies signed, which if you are not, you don't have that time pressure on you. And it's actually much more difficult at times because along with the fact that we change jobs, many of us do at least 2 hours commute, if not more. And not to mention all the paperwork by changing jobs every year or every not year, and also getting to know new consultants, new teams. And among them, getting all our competencies signed, doing audits, doing papers, doing research, doing presentation. If we are lucky, our training pathway would be like the smooth road that you have. Yes, it's an uphill one, but it's a smooth track. If you are unlucky, which probably for 1 or 2 years you might be, or in my case, perhaps longer than that, like we had COVID for 2 years, then you won't have this smooth track. It will be a rugged mountain hill that you will have to climb. So things that I feel like I could have done differently or I had done differently, which helped me, it got me thinking. So that's why this video is made. So when they were asking me, my first thought, as I mentioned, is that it was 4 years or more, basically. So why are the ST3 friends are asking me now? Because by that time, treatments will be changed, the guidelines will be changed. Whatever notes or whatever treatment I have right now is not going to be relevant to them. The resource will not be relevant to them. And also, you have to gain so many competencies. So, focus on the things that you can gain rather than thinking about something that's going to come 4 years afterwards. And of course, life, most of the times, you will have children, you will have a PhD, you can do out of program. So all of that will coming. So that will extend your training. And if you go part-time, then this will extend your training to 10 years, if not 6 years. I mean, I've had trainees who were ST5s when I started, but because they went to PhD, they're now actually same grade as I am. And I've also known trainees who are part-time with a PhD, but who are still trainees, and they were like senior trainee before I went to the training, entered the training. So these things basically came into my mind first. But then upon reflection, I thought, I looked back at my training and I looked back at the things I did do, which I think helped me a lot in the exam, and the things I could have done a bit more differently. So this is why this is a reflective video for all my ST3 colleagues who are any person who is like, still has some years to gain, but what they can do that will actually help them for the exam. So when you are ST3, you are like that, the big sea of ocean, and you're happy and you're jumping off like that. And that's what I did. And there are things that I did very good that I actually found very helpful for my training and also for my exam. So number one is that ward round. From ST3, I led ward round independently. And that was actually helpful because number one, I never had any issues with ward round, and ward round is a competency in our new curriculum. Number two is you actually see these patients in the ward round. So you see complications, you see how the patients are, what's the follow-up pathway of these patients. So that's actually very helpful in the exam because you can actually tell them what you are seeing. And what you see, you remember much better than what you have read. So doing the ward rounds is actually helpful. So use them as they are. That is a learning opportunity for yourself. If you have a trainer with you, ask your trainer, ask your consultant that can I lead, and you will just watch me and then correct me if I'm doing anything wrong. And if you are not, then usually you will have an idea about checking bloods, about checking the images, about checking how the patients are. So lead your ward round and use them. See how complications were managed. So anytime you see another person's complication, and especially your own complication, see what was done, see how it was done. And that, because these questions are come to your exam, and you will actually know how do you manage them because you have managed them. For example, if you've done an upper GI job where you've had esophageal cancer operations and you've seen patients with chyle leak, you know how they are managed. Pancreatic fistulas, you know exactly how they are managed. After splenectomy, what are the complications? You've seen those complications because you have done the ward round, because you have seen those patients. And when they have come with the complication, then you have followed them up so that you know how they are managed. Keep a diary if you can't remember, because obviously our training is very variable and we are not always in the hospital and we're not always with the same firm. So have a diary regarding those patient details and follow up their pathway, how they were managed. And this will actually help you. I've always followed up all my patients, even if I've done an appendix, I've followed them up. It's because following up your patients does two things. Number one, it's good for yourself. You know that, you get reinforced with your why power, that when you see a patient who has done well, is going home after being sick, like for an ST3, most likely you will end up doing appendixes more, and you will see a patient after the operation and you will see the patient is all pain-free, and that's just the most wonderful feeling. And that's why we became surgeons. The second thing it is important is because you will develop a practice of your own and your consultants will notice that, and therefore your consultants will appreciate more. No, we are not technicians, okay? General surgeons, surgeons are not technicians. We are people, and I know that some of our medical colleagues try to think, oh, surgeons don't use their brain. We actually use our brain much more than they do, because we actually use our brains and our hands. So we actually have to correct a patient's anatomy to restore their physiology. It's not just medications. We use our skills, medications, and all of that. So follow up your own patients. This will actually be very helpful for you in future. And you will also get a good reputation and a good rapport with your consultants. Clinics. Now, we all hate doing clinics, but it's actually clinics that you learn how patients were managed. So if you have a particular consultant whom you like, who you find that very good training, go to that consultant's clinic. If you have a specialty that you don't know much, go to that person's clinic or go to that consultant's clinic, specialties clinic, so that you can see those patients, because you will be asked questions based on how this patient has presented to you in clinic like that. And also, even if you're not running the clinic, if you see how your consultant is speaking with them, you will learn so much of communications clues and how they communicated with the patient. Like, this is just unbelievable. So this is something you really utilize. And also the management your consultants did, this is something you're going to say in the exam. So utilize those clinics as a learning opportunity, because they are. Deanery teaching. It's moved to now post-pandemic in most places. It's moved to online teaching, and but before that it used to be face-to-face. And actually, before the exam, when I always kept a diary about all my deanery teachings, when I opened it, I actually found that most of the questions or the topics that the deanery teaching was done was actually topics that came was faced by my colleagues in their examinations. So deanery teachings are actually quite helpful source of information, because remember, it's pan specialty, so they are targeting the ST6 or ST7s, or people who are sitting for the exams. So by taking these is a useful resource, so use that basically. Sign off your competencies as much as you can. So do all the audits, do all the other papers, QIs, research things that you need to be signed off. Do all the courses necessary. If you really can help it, I would say try to do your ATLS near the time of exam or in your ST6 year, because that way the ATLS will be fresh in your mind if it's possible. And also, a lot of questions come to the exam from the ATLS. So that's also helpful. So sign off the competencies as much as you can, because then it just takes the pressure off. And that's what I did. Like, I've done my audit competencies. I've done most of my cases competency by the time I was ST4. The basic ones there. The bigger operation ones, of course, you won't be able to do, but the other ones you can. So focus on those. Maximize my training opportunities. So if I had a consultant trainer that I really liked, who was a good trainer, I would maximize my training opportunities. And this is my personal view. The way I see it is, I'm not going to be a trainee all my life. I only have a finite amount of time, and I won't have this energy all my life also. So I will maximize this time. Now I have it. There is no job in the world that doesn't have a grind to an endure. And in surgery, it's grind and endure is much more sustained. But even then, sometimes I've went through the grind, and I think that really helped me in terms of especially operations, because when someone asked me how would you manage this, and I would just tell them how I've seen it in management. So that is the other thing. So journal about your operations, especially the ones that you have done, and also especially the ones that you have seen. I wish I had done this. I've done a lot that I have done, but when you see someone else's operation and you journal about them, then you can also notice the tips and tricks that they used, and that is helpful for you to build up your own practice. So do these things, and I found them really helpful that I did in my training that really paid off. Now, looking back again to my training, and these are the things that I wish I did differently that would have actually helped me a bit more. Attend MDTs mindfully. So I've always attended MDTs, but I didn't attend them, I would say, mindfully always, because there are so many cases. The imaging is not always great, and also we can't always take the time to attend them. So what I mean by mindfully, pay attention to the scans, pay attention of what they're seeing, especially learn to read MRIs, because you will get MRIs in the exam. Pay attention to what trials, what chemo regimens they're talking about. Pay attention to what staging they're talking about and what treatment they're giving. Pay attention to the discussion. And also pay attention to how the patients are being presented. Pay attention to what the histopathologists are saying regarding the grade and how they are managing it. Because all of these things, they come in the exam. So it just, if you know them, if you've seen them, if you paid attention to them, especially about also in specialties that are not yours. So if you pay attention to that, when you see them next time, trust me, your brain will recognize that pattern and your brain will pick up that much more quicker than other things. Pay more attention to the nitty-gritty. And what do I mean by that? So pay more attention to the governance meetings, like how are they managing a complaint? What are they doing? How are they doing a duty of candor? How is the consultant consenting a patient? And again, you have to choose your consultants. There are some consultants who are very thorough, some consultants who are not. So choose the consultants who are very thorough. How are they paying attention? In the histopathology, what are they reading? What is not just the final bit, but the entire report. What is PT1, V1, V2, N2, N3 means? What is the grading? So know all of that. If you're doing if you're upper GI or lower GI, what is the endoscopic picture? How was it described? Because all of this will come to your exam. So pay attention to the nitty-gritty. Again, this will help you massively. And it doesn't matter which specialty you are. Even if you're breast, you will get an Barrett's in the exam. You will get a polyp in the exam. Okay, so pay attention to that, and you will be asked how you describe that. You will be asked how you describe this cancer in the endoscopic appearance. So just pay attention to that. It will save you massive amount of time later on. Confront your weakness. So my weakness was vascular, one of them. So I did vascular job. My other weakness, I will say, was upper GI. I've never had a proper upper GI resection jobs. So I had to read a lot about their complications and how you manage them compared to the other specialties such as breast, vascular, colorectal, or trauma surgeries, I will say, or even endocrines, because I've done endocrine jobs. But I've never had a transplant job, or I never had a proper upper GI or HPB resection job. So if that is your weakness, so make an effort to go to that specialties MDT, because you will learn a lot. Make an effort to go to a clinic of a nice consultant, of a good training-minded consultant of that specialty. My other weakness was academic. I'm not an academia. So, how do I present paper statistics? I was really quite scared of that. So if you have a journal club, then join that journal club, get critiqued, because your presentation will be so much better. And remember, you're not attending the journal club to just get a point. You're attending the journal club for that examination. So I wish I had done that. I must say, after exam, I'm much more better at critiquing. I'm not 100% better, but I'm much more better at critiquing. And it's actually not that difficult once you learn. And because they will ask you those questions, the same questions they will ask you in the exam. Signing off competencies. Again, I've done a lot, but there are things I wish I could have done better. I'm a bit lazy with my logbooks and everything, and I just wish that I would have been on top of it. So our ARCP is really helpful, but I could have been much more proactive, I will say. Maximize training opportunities in each specialty. So when I was in vascular, for an example, it was not my specialty and I didn't really enjoy it that much. And I don't like endovascular interventions because I hate wearing a lead shield. But looking back at it, perhaps, and in hindsight, I've done a lot. Like I know a lot about carotids because I've done the vascular training. I know what complications to look for. And I did try to read the companion series about it, but I just did not enjoy the companion series that much, or I tried to read it too deeply, which I shouldn't have. So I would say whatever specialty you go, read the companion book, at least of that series. The other thing you can do is listen to the podcast, Behind the Knife, very good. If you want FRCS themed, then listen to Studying for FRCS, because that's FRCS themed. And also you will see those complications in those specialty, or see those situations in those specialty. And this will just solidify that memory and that knowledge in your brain. I wish I knew about Behind the Knife a bit later. I wish I knew about it earlier, because it is also helpful. And but for FRCS, there's really not much, there's really nothing there out there, I found. So that's why I summarized my study notes in the podcast, basically. And I think if I had that now, I would have been much more better. Start your preparation early and stick to your timeline. So some of you, when you become an ST6, you might not get an outcome 1 to move to ST7. And that really thwarts you. Like I had a timeline that, I would, when I was ST6, I would start my preparation. And I did start, but then I got thwarted by other factors that were beyond my control. And looking back at it, I should have stuck to my timeline a bit more strictly, because I just put unnecessary pressure on myself later on. So I would say stick to your timeline and start your preparation early if you're that type of person. But again, if you're someone like me who does not get prepared unless I have a date, then then do other things that will help you, basically. That's what I'm going to try. That's what I should have done in my reflection, I would say. Be your own trainer. So as surgeons, we define ourselves by our skills. And the problem is sometimes, and it is an apprenticeship, but sometimes we don't get good trainers like that. And I am by nature an extremely hardworking person. And this is something I've received consistently throughout my life as a feedback. I may not be the most smartest, most intelligent, most academic, but I am extremely hardworking. But at the same time, I would say that I've wasted those hard work on some trainers who actually doesn't deserve it, who actually did not treat me with as much as respect and as much as dedication as I was giving to them. So for them, it was just a job, and I was just a cog in the wheel that they could, they were just using. So looking back at it, and I think now I know much more. I'm obviously older. So again, like I said, to people who you have, I worked hard regardless for anyone. But now I would say that, I will give probably my 150% to a good trainer who I know will give back to me. But for the rest, it's just a job, and I will do my job, which I do 100% any given day. And that's what I will do for them. So, and there are things that were beyond my control. So perhaps I should have been, I did do a lot of it, but still I think I could have been a bit, if I had this realization that I have to be my own trainer, then I could have done it a bit more differently. And in many ways I have done, like, for my laparoscopic skills, when I was a non-trainee, no registrar would teach me. So a lot of my ST3 colleagues actually taught me, my ST3 regis taught me rather than my senior ST7 or ST8 regis. And I faced a lot of bullying and a lot of other factors, and I had to face them all on my own. I had, with everything basically. And again, I'm not saying that's the best thing, but that's how I am, and that's how I had to face. And this is why I'm developing 2 other channels, which is the Mindful Learner and Mindful Surgeon. So if you're interested, please join them. Just to keep an eye out about how you can improve your skills and how you can improve your thinking. Because at the end of the day, your training, how good is it going to be, how it is a lot of it in your mind. And once you get through that barrier, then you can really, really improve your training. So that is my take on the things I wish I could have done differently. So thank you for listening. And if you've liked this video, I would really appreciate if you give me, leave a comment and subscribe and like this video, as this will help me to reach other people with the similar needs. And if you have any particular questions, please leave a message or a comment, or DM me on Instagram by the same group name. And I hope to see you in future, and I wish you all the best.